Today, we will demonstrate the 4 techniques in conducting the physical examination, which are the
IPPA,
inspection,
palpation,
percussion,
and auscultation. Good morning, Ms. Angelica. I am Sandra Lane Rodam, a nursing student at Biliran Province State University. And today I will be going to assess your physical health. So let's start off with washing my hand. So again, I will be having your physical examination today. So the importance of this physical assessment is to know the complications of your body and to assess your whole body if there are problems or abnormalities.
Inspection is the most frequently used assessment techniques. With inspection, you use not only your sense of sight, but also your senses of hearing and smell to inspect the patient critically.
So first off, I will start with assessing your general consciousness through inspection. So can you follow this ball pen, the direction of this ball pen for me? So in assessing and through inspection, Angelica's level of consciousness is great. You don't show any signs of distress or having difficulty in breathing. And your posture is alright. Your facial expression doesn't show any forms of anxiety. Your posture is good. Your pace of speech is also good. And your dressing and grooming proves to be great. Angelica shows signs of responsiveness, and Angelica doesn't have any unusual body odor.
Palpation. During palpation, you are using your sense of touch to collect data. It is used to assess every system. Palpation also allows you to assess surface characteristics such as texture, consistency, and temperature, and allows you to assess for mass, organs, pulsations, muscle rigidity, and chest excursion. It also lets you differentiate areas of tenderness from areas of pain. There are 3 types of palpation, which is a gentle palpation, pressing about 1/2 inch, while the deep palpation is the pressure with the fingertips or pads of a depth greater than 1/2 inch. Movement is a palpation technique used to assess a partially free-floating object.
So at this moment, I will be demonstrating the palpation. So Miss Angelica, could you lie down in this bed? Assess you better, so fine. Okay. So I will be performing a light palpation in your abdomen area. So to do this, I will apply gentle pressure in your abdominal area with my fingers. So So at this moment in time, I will be applying a deep pressure in your abdominal area, extending to greater than 1/2 inch with my fingertips. So let's start. So this time I will be performing a deep palpation with both my hands extending to more than 1/2 inch in your abdominal area. So in palpating your skin, I will use my dorsal finger to determine your temperature. So I will palpate your pulse through the use of my fingertips. So let's start.
Please rise up na. So I will be palpating your back for the tracking of the vibration. Can you hold this? Oh. So can you speak 99 when I lay down both my hands on your back? Can you?
Yes.
1,
99. 99. 99.
So Angelica, your pulse rate is 65 beats per minute, and in palpating your abdominal area, I track no lesions or muscles or any kinds or forms of having abnormalities. While in palpating your back, I can sense no abnormal vibration. So that is all. So Angelica, your pulse rate is 65 beats per minute, and in palpating your abdominal area, I track no lesions or muscles or any kinds or forms of having abnormalities. While in palpating your back, I can sense no abnormal vibration. So that is all. Percussion. Percussion is used to assess density of underlying structures, areas of tenderness, and deep tendon reflexes or DTRs. There are 3 types of percussion: the direct or immediate percussion, indirect or mediate percussion, and fist or blunt percussion. So for the direct and immediate percussion, may I request you to please. So in performing a direct fist percussion, so I will use the ulnar surface of my hands. The indirect fist percussion, so I will use the non-dominant surface of my hand with my ulnar surface of my fist, so that I can percuss your body. So may I request you, Ms. Angelica, to stand up and be seated so that I can. So I will be tapping this percussion hammer to test your reflexes on your knees. So in percussing Angelica's abdominal area using indirect and direct percussion, so I felt no changes and her organs are intact. And while using the percussion hammer to test the reflex of her knees, I felt that her reflex was good. Auscultation. Auscultation involves using your sense of hearing to collect data. In listening to sound produced by the body, such as the heart sounds, lung sounds, bowel sounds, and vascular sound, there are 2 types of auscultation. The direct auscultation, which is listening directly to the sounds produced by the body without a stethoscope, while indirect auscultation involves the use of stethoscope. So today we will be conducting an auscultation. So Ms. Angelica, can you lay down? So your blood pressure is 120/78. So Miss Angelica, can I request you to sit down for your respiratory, to auscultate your respiratory. Okay. Here. So, Miss Angelica, can I request you to sit down for the auscultation of your respiratory? So, can you breathe for me? Breathe deeply. Again. In taking your blood pressure to the sphygmomanometer, so I did not. Your blood pressure seems to be normal accordance to your age. Then in auscultating your respiratory rate, so I did not notice abnormalities in your breathing rate. I did not hear some wheezing, pitch, or other sounds that is evident for abnormalities. So that will be all. So Miss Angelica, I want to thank you for participating readily and for being responsive in this assessment. So have a great day ahead.